And the topic today is innovation to support academic programs in a rapidly changing healthcare environment. And I really appreciate you joining us today. So let me go to my first content slide. I'm going to start with a brief description of the University of Toledo College of Medicine, and I think that this helps frame why we got into this alternative funding strategy. So we are a relatively new medical school. Our first class graduated in 1973. About 3 decades later, the Medical College of Ohio merged with the University of Toledo. That occurred in 2006. We're located in an urban, industrial, Midwestern community of about 250,000 people, with about 500,000 people in our region. Importantly, we have a relatively large teaching mission with about 175 medical students per year, and yet we have a small academic teaching hospital which provides a mix of tertiary care and non-tertiary care. So into that context, we place the issue of academic health center funding. And this is a slide taken from the LCME and the American Association of Medical Colleges, which displays the sources of funding for medical schools from 1977 through 2015. And you can see that the majority of the increase in funding has been in the provision of medical services, our hospitals and our practice plans. There has been growth in federal research, but not as much as others. Tuition and fees are relatively flat, and state and local support are relatively flat. What I would say is, as the dean of a medical school and as the EVP of clinical affairs, that all of these sources of funding for our academic mission are becoming more constrained. Certainly, the ability to take money out of the clinical stream to support academic efforts is being challenged. Not a week goes by where we don't have some conversation regarding NIH or NSF funding and the potential threats to that. Direct governmental support, at least in the state of Ohio, has been declining for some time. And there's a perception, which I think is accurate, that simply asking our students to pay more in tuition is not going to be a strategy for success as we look to the future, because our students already pay a very, very high tuition. And so we needed new solutions to fund our academic programs, and one of those that I'm going to talk about today is our Medical Research Society, which is basically a way to get the community investing in our medical science investigators. As I mentioned before, the National Institutes of Health and other funding sources continue to become more and more competitive. As I described earlier, the University of Toledo is a small market academic health center. We and others struggle to maintain and grow our research funding. Interestingly, I was at a AAMC meeting a few months ago with the deans of the medical schools, and they asked every dean to raise their hand if they were trying to grow research funding, and I think every single dean in the audience raised their hand. So even though I describe this as an issue of small market academic health centers, I do think it's an issue of all academic health centers. And we need additional sources and strategies to fund promising early career investigators. This is certainly a gap. How do you either bridge an early career investigator, or how do you give them an initial funding strategy to help them be successful? So into that, we dropped the Medical Research Society. What I would say is that our community, Northwest Ohio and Toledo specifically, has an established interest in biomedical advancement and discovery. Importantly, though, not all of the potential donors in our area are ready to make a substantial or transformational gift. Certainly, we need a pool of support. We need a way to develop potential donors, waiting for the one high-value donation or the handful of high-value donations in order to meet our academic needs, and specifically some of our research needs, won't work in Toledo. And so into that space, we've developed a philanthropic group called the Medical Research Society that has paying members who review and select projects to fund. And in the next slide, what I'm going to do is give you a bit of a process map about how the Medical Research Society operates and how the funding occurs. So on the front end, our junior faculty are able to apply for funding. And so there's a very short application that is done each year. There's a schedule when we get applications from junior faculty. They have a form to fill out. Importantly, part of the criteria for being an applicant is that you have to have submitted a grant application to the NIH. Your grant has to have been scored, and those critiques, along with the face page of your grant application, the specific aims, are included, and then the junior faculty member states in a page or two how funding from the Medical Research Society would allow them to address the concerns raised in their critiques and create a more fundable project. This packet of material, which includes, as I stated, the critiques, the aims of their grant, how funding would help, then goes to our Research Advisory Council, which is composed of senior faculty members, well-established, well-funded investigators, and those applications are then screened by that group. And then of the applicants, the Research Advisory Council selects the most meritorious of those initial applications to go on to the Medical Research Society donors to be evaluated. And so typically in the spring of the year, think May, what happens is that we have a meeting of the Medical Research Society where the finalists come and present to the donors. And think of it in this way: you have a room with a substantial number of people in it. Those people are the donors. We strictly limit the presentation of the faculty applicants to about a 10-minute presentation with 10 minutes of question and answer. And so in about an hour's time, the three applicants will present. They'll have questions from the potential donors, and then the applicants are ushered out, and there's a confidential voting process where the donors themselves vote and select projects to fund. And it's really a dynamic meeting. The faculty presenting do their level best to be able to present their science in a way that's understandable to the lay public, which is actually an excellent skill set for them to hone. And the donors get a real tangible appreciation for the science that's being done and for the types of projects they want to select. And in general, I've been very, very impressed by the donors' ability to ask thoughtful questions, to consider issues like commercialization and potential impact, the level of science, the critiques and the impactfulness of the funding from the Medical Research Society on their on the investigators' career plans. And so it's really a very dynamic meeting, and the donors get really, really engaged. In fact, each year that we have one of these events, the common theme is, at the end, how do we get more money? How do we get more money donated to help fund these worthy junior investigators? And obviously that's a great conversation to be having. And so what are the outcomes? So thus far, I think we're now at about 37 or 38 community members. We just had a dinner with some potential donors a month or so ago and have had, I think, 3 additional join. Each one of the donors commits to donating $25,000 to be a member of the Medical Research Society. In addition, several donors have stepped forward now, and after having participated for a couple years in a row, are either making bequests or making more substantial donations to help fund the Medical Research Society. And so overall, we've now been able to raise several $1 million specifically to help fund these junior investigators and help propel their careers forward. So what's the impact? Well, the first and foremost is that we've been able to fund several investigators through the Medical Research Society. And for those investigators, it's a big deal. The money's not enormous. I think we give about $50,000 per award. But for our junior investigators, that allows them to buy a little bit more reagent or maybe hire a postdoc or an assistant to help them on a particular project. And so it is meaningful. Probably what's more important, though, is that the donors themselves are very excited about funding research. It is a very new conversation in our institution to hear donors talking about the interesting research that's going on. And importantly, the donors begin to view these research projects as their projects. I selected Dr. So-and-so. They're doing ovarian cancer research. That's important to me. That's my scientist. And they remain in contact with the investigators and help keep the excitement going. And that excitement then occurs when donors talk to other individuals in the community and help bring more people into the research society. Importantly, our researchers are also excited about the notion of community support. These are challenging times to be in biomedical research. Not everybody's well-funded. Knowing that there are people in the community who are willing to make substantial gifts to help support their research excites not only the researchers who are funded, but also other scientists in the university who begin to understand that this is more than just them and their research. This is really an engaged community supporting their activities. And finally, of the 6 finalists, 3 of the 6 have gone on to get their NIH grants funded, which is a terrific message coming back to the donors, to the members of the Medical Research Society, because each time we update the finalists and let them know the status of their NIH funding and the amount of NIH support that has been received, the donors again think of this as a terrific investment for their community. Hey, we've gotten $4.5 or $5 million based on a relatively modest contribution. And so again, I think the Medical Research Society has been impactful. It's impactful on our donors. It's impactful on our researchers. And our finalists are getting funded, which is obviously a key element of our success. So in summary, about innovating for academic funding, it's certainly my opinion, and this is an opinion, but it's my opinion, that traditional funding sources are either threatened, so the NIH dollars or state government, those sources are clearly threatened, or they're constrained. There's a limit to how much we can charge in tuition, and it's increasingly challenged to divert clinical revenue as the margins on clinical revenue continue to tighten. And so into that space, we've developed several innovative models to support academics, both teaching and research, one of which is the Medical Research Society, to bring additional resources to support that one particular group of very valuable investigators, the junior investigator or the investigator in transition. And so in conclusion, we believe that some academic health centers will need to look at novel mechanisms to fund these academic efforts, and sort of the traditional models that got us here probably won't get us where we need to be in the future. I'm happy to take questions now.
Thank you very much, Dr.
And if you would like to ask a question over the phone, please press star 1. Again, that is star 1 to ask a question.
You also can submit your questions through the chat box on your left-hand right corner. So, Dr. Cooper, thank you so much for your presentation. While we're waiting for questions, I would like to ask how long it took you to actually establish this research endeavor?
Yeah, so we've been doing it for a couple years now. The first year was doing some basic planning and setting some goals, and then really we've been active for about 2 years and have been ramping it up. So it looks to me like we have a question from Alicia. Alicia asks, how did you identify the individual society members? Great question, Alicia. We actually, the idea of the Medical Research Society, I'd like to take credit for, but in fact it came from a donor. A donor said, hey, I'd like to do more to support research. I can give you some money, but is there a way that we can do this that would be more impactful or meaningful? What if we had sort of a society of people who supported it? So she came on board and made the first gift. Candidly, my wife and I made the second gift. And we made a pact that every time somebody joined the Medical Research Society, we would ask them to sponsor a get-together with 3 to 5 additional people that they knew who might be interested. And so what we've done is we've kind of went from here to here to here, and each time doubled the number of people who are participating. And that's been a pretty successful model for us. So anyways, to specifically answer your question, how do we identify the initial society members? It came from a donor in the community, and then between she and I, we started inviting people, and people began to aggregate onto it, and it's really caught on. Did that answer the question? Oh, thank you, Alicia. Yes. All right. So we have a question from Gayatri. I hope I got your name right. If the proposals are scored, then why have RAC review? Why not have the MRS be the reviewers? So I'll try to summarize that. So the proposals have been scored by the NIH. Why are we having our Research Advisory Council, which is a faculty group, review it? Why not simply hand it off to the Medical Research Society? I think the answer is that we have more applicants with scored grants than we have sources of funding. And so what the RAC review does is allows us to narrow the list of finalists to a smaller cadre that then we can then put in front of the Medical Research Society. I think there's a limit to the patience and attention span of the donors. They really want to help fund research. They really want to be participatory. The contrast to that is they're all busy, productive folks. They're leaders of industry, they're attorneys, in some cases they're physicians, and so they want a tangible chunk of material to look through, and they do take the reviews very seriously. And so the strategy that we put together was to do an initial faculty-based screening, winnow the list down to a more modest number, and then that modest number goes to the members of the Medical Research Society to actually have the presentations and then to do the voting. Did that answer your question? Great. Okay. Other questions from the audience?
There are no questions over the phone at this time.
Okay. Alicia asked, how long does it typically take the faculty awardee to turn their award into additional funding from the NIH? In our experience, the cycle length has been pretty short. Remember, they already have a scored grant, and oftentimes with their scored grant, they have a handful of critiques that they're going to need to address in order to get their NIH application back in. And so this, the $50,000 award is not a big deal, but it's a quick shot of cash that is immediately released to the investigator, and they can scale up pretty quickly to address their critiques. And frankly, we are very encouraging of them to do exactly that, which is take the money, use it to support whatever additional work needs to be done, and then turn that around quickly and get their grant application in. And so the cycle length has been a year or so. It's been pretty quick. We have another question from Gayatri. Are there any strings attached to the Medical Research Society grant, or is it a straightforward gift? And what he means is there any expectation of commercialization? So first off, there are no strings attached. It is a straightforward grant given from the foundation to the investigators. Regarding commercialization, undoubtedly from the community donors, that's something that is of consistent interest for them. You know, how are you going to take this to market? What's the impactfulness of this likely to be? But we've not put any stipulation on the funding or the use of funding regarding a pathway to commercialization. Are the donors interested in intellectual property? Absolutely. Absolutely. There's not one of these meetings that goes by that one of our donors isn't having a conversation, you know, what's the intellectual property around this research? Are you protecting your IP? How do you make this meaningful and commercialize it? Another question is from Gayatri, do they want to invest in the intellectual property? We've not had a donor yet step forward and say, hey, I'd like to put money into this project, although I could certainly see that day coming. Given the level of sophistication of the donors and their involvement in industry, that's definitely a possibility. I have to say you guys are asking great questions.
Does anybody else have any questions?
Guthrie made a comment. He said perhaps an angel investment format for those of the Medical Research Society. That would be an interesting idea, and you know that might even be a parallel pathway that sits beside the Medical Research Society. So something either codependent or independent of the group. Interesting idea. All right. If there are no more questions, I really appreciate everybody's attention today, and I hope you found this useful.